So, cardiac recovery and relaxation, we need to normalize these things going hand in hand. We need to normalize relaxation and dealing with and overcoming emotional trauma as a part of the cardiac recovery process. You know, you have your cardiac event, you have your surgery or your heart attack, you get your stents, and then you're released into a cardiac rehab program. And these cardiac rehab programs are wonderful. You know, they're getting you moving, they're exercising you, they offer a support group, and they offer you nutritional information and all these ideas around lifestyle. But very often the thing that's missing is effective stress management and relaxation techniques. Now, as I've discussed before, stress is so detrimental to your health, especially your cardiac health. This should be addressed mainstream. You know, it's where I come in is, yes, you know you need to do things to lower your blood pressure. You know you need to stop smoking. You know you need to eat healthier. But these lifestyle changes can be difficult to make when they're tied to an emotional response. You know, emotional eating, you can't just turn that off overnight. Smoking, if it's a deep-rooted habit, it's very hard to just turn that off overnight. So that's where therapy can be helpful to help you overcome and make these lifestyle changes that are wired into you, that are seemingly hardwired into you. What I always found fascinating was some people would have a cardiac event and boom, that was it. That was enough of a shock, enough of a life reset to make them make these radical changes. Other people, like I say, you know, the emotional eating, the smoking, the unhealthy lifestyle was their form of stress relief. So without that, they're going to be stressed, and stress is just as bad for the health as some of these factors. So in fact, unregulated stress is as bad as smoking 20 a day, some studies have said. So you really do need to tackle the lifestyle side of things. You do need to go to the cardiac rehab. You do need to do the exercises they prescribe, but also you need to focus on stress reduction and relaxation as a practice to be able to fully recover and move forward. The amount of people I speak to who have, you know, gone through what led up to their cardiac event, their heart attack, and stress plays a massive role in this build-up. Yeah, the landscape was set. You know, the high cholesterol was there, the high blood pressure was there, perhaps the smoking was there. All these factors were there, but it was the stress of a certain situation that pushed them over into that MI, that was a trigger or a contributing factor that led them down the path to actually have the heart attack. So yeah, you know, you go for your stent, you have your intervention, and then you're given your blood pressure medication, you're given your cholesterol medication, you're told to move, you're told to eat healthy, you're told to stop smoking. But stress management is just as important and just as beneficial to your health as these other things. It's crucially important, and we really do need to normalise stress reduction and relaxation as practices for cardiac health going forward. Have a great day.